First, I would like to take a moment to acknowledge that today is International Overdose Awareness Day. It's with a heavy heart that I recognize that we continue to see so many loved ones in our community die from these preventable deaths. The COVID-19 pandemic has had a serious impact on people who use drugs, their family members and friends, and the service providers who work so hard to support them each and every day. My team and I remain strongly committed to working with others to improve our collective response to this crisis. Turning our focus now to an update on our local COVID-19 experience, I'll share what we've learned, what lies ahead for us, and how we can work together to make important choices over the next few months to stay safer as we live with this virus. Science is hard at work to defeat it. Reopening is happening. School is about to start, and fall is coming. And in the weeks and months ahead, we're all likely to be coming into much closer contact with one another. We have to balance all of these things to minimize the potential risk to ourselves and the people around us. Amongst the good news, and there is good news, is that we have done well in terms of managing virus spread and protecting our healthcare system from being overwhelmed, as was the case in many other major cities. Nonetheless, we still have daily COVID-19 cases and community spread. Today, I'll tell you what we've learned here at home and from around the world, and about the ways we're getting ready for the resurgence of COVID-19 in the weeks and months ahead, and the things we need you to do as Torontonians. But first, let's look at the figures on COVID-19 today. Since the beginning of the pandemic, we've seen a total of 16,044 cases, an increase of 40 new cases since yesterday. While the majority of people recover from COVID-19, in public health, our focus is on preventing COVID-19 infections in the first place. Our objectives throughout this pandemic have been to minimize the loss of life and serious illness, to reduce the spread of COVID-19 in our city, preserve the capacity of our local healthcare system, and to mitigate the negative social, economic, and broader health impacts of the pandemic. The only way to achieve these objectives is for all of us to keep washing our hands, watching our distance from others, wearing our masks, and avoiding crowds and close contact. We are at an important point. The first stage of this outbreak is behind us. You can see it here on this graph, which shows the course of COVID-19 in Toronto, rising rapidly from the start of March, peaking in April, and then a general decline in the numbers from May onward. We have been more fortunate than many places, but our statistics still represent a tremendous amount of illness, loss, and suffering in our city. The choice we all face now is what we will do as we move toward the fall and winter phase of COVID-19 in Toronto. There is no question that we will see resurgence. Amongst the best projections we've seen are those from the Center of Infectious Disease Research and Policy, based at the University of Minnesota. They have described 3 possible scenarios. Scenario 1, a series of repetitive small waves that occur consistently over the next year or so, then gradually diminish over time. Scenario 2, a large wave in the fall or winter with smaller subsequent waves thereafter, similar to what was seen in the 1918-1919 influenza pandemic. And scenario 3, a slow burn of ongoing transmission and case occurrence, but without a clear wave pattern. There is no way to know what will happen exactly. However, my team continues to listen to emerging scientific evidence and consider the latest facts to protect your health now, this fall, and this winter. This summer, we brought on additional staff to do case and contact tracing so that we have more people to help with this critical work that reduces virus spread.